We're here at Nashville 22 at the Euramigos meeting. Matt Galsky, Mount Sinai. Matt, we just had a discussion about the adjuvant space. You talked quite strongly about the use of adjuvant nivolumab in unselected patients based around the clinical trials. Other people like me push back and saying we're not sure about the upper tract population. We prefer the PD-L1 biomarker data. The Twitter poll suggested a complete split in terms of 25% for biomarker positive for all comers, for ctDNA positive, and 25% for none of the above. How can you be so confident that everyone should be at least offered this?
So I think that clinical trials, randomized trials, are designed to answer a specific question, and we should respect that. And so this trial was designed to answer two questions. Does adjuvant nivolumab improve disease-free survival in the all-comer population? Does it improve disease-free survival in patients with tumors harboring high levels of PD-L1 expression? Both primary analyses were positive, and so I think that's the data. I think one could select patients based on biomarker expression because the data support that, but it also does support an all-comer population.
There was debate about the upper tract population. The POUT data for adjuvant chemotherapy looks stronger with a survival signal, of course, than the nivolumab data, but you also push back a little bit on that. Describe me through that.
Yeah, that's a subgroup analysis. It's hypothesis generating. We shouldn't be making treatment decisions based on a subgroup analysis. I think that the only place that it's relevant is in a patient who is cisplatin ineligible. That's a patient who would have been eligible for both POUT and Checkmate 274, and in that patient, I think a discussion about both should be offered.
Can we be confident without any overall survival signal? When are we going to see the survival signal, and should we make decisions before we see that survival signal?
Overall survival is an event-driven analysis. It hasn't been done yet, and remember, it's a secondary endpoint. So I'd like to see it going in the right direction, but it is a secondary endpoint.
Matt, fantastic. Lovely to see you. See you soon.
Thank you.